from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Baptist Health cardiologist Dr. Scott Davis is here to tell us more about a stunning announcement involving heart health and dementia, two things that don't really associate with each other too often, but this is something that in the medical world is making a few waves.
Big study got released this summer looking at the effect on blood pressure control and development of dementia later in life.
Okay.
And they looked at over 9,000 people, and they did two arms. They did a regular control arm of blood pressure control, looking at the standard 140 systolic, the upper number, versus a more aggressive approach at 120. And they found a 19% reduction in mild cognitive impairment. In other words, your cognitive decline in the aggressive arm. And it's been a big game changer because in the world of dementia, Alzheimer's, vascular dementia, they've not quite found a perfect bullet yet to really to treat it. And all these amyloid treating drugs have just really not hit the mark like they've wanted to on the research side. Showing just blood pressure control, it's really encouraging over the long haul. And again, we've talked about blood pressure and the effect of blood pressure control a lot on this segment. It is really moving a battleship. Getting control early on can change the endpoint way downstream. And this showed uniform reduction in cognitive impairment, and then also a subset was studied looking at the imaging piece, doing MRs of about 400 of these patients, doing magnetic resonance imaging of their brain, and showing white matter lesions, which white matter lesions, as you may know, are associated with developing the vascular dementia piece that's associated with Alzheimer's. Look, we know dementia has multiple causes, but the micro small vessel disease piece is a very significant one, and the postulate here is that lowering blood pressure helps to reduce the incidence of that small vessel disease. The data was uniform across the board in that whether you're a man or woman or across all racial spectra, 30% were African American, 10% of the study population was Hispanic. So, and all benefited. So, and it also showed benefit across all drug classes. So, whether you're on a name brand medicine or a generic, it didn't matter. So, it makes us really rethink then aggressive blood pressure control from a totally different perspective than we have in the past. Besides just lowering your heart attack and your stroke risk, now we're looking at, okay, there may be a benefit too for the development of dementia later in life.
How common is hypertension?
I mean, it's one of the most prevalent processes we have, one of the most prevalent diseases. I mean, 60-70% of folks out there have high blood pressure. The kicker is that the gross majority of folks don't walk around knowing you have high blood pressure. Very few people know that their blood pressure's up. They might get flushed, they may feel a headache, they may feel kind of weird. But as a rule, when your blood pressure gets 160, 170, most folks don't know it. But doing this kind of interaction is so important to kind of beat the drum to say, look, if you don't have a blood pressure cuff, go get one. If you haven't seen your primary care doctor in a while, go see him. Let's see what your blood pressure is, and then let's do something about it if it's elevated.
Yeah, and especially since those new guidelines were changed within the last year, more people fell into that category, right?
So this was the Sprint Mind study, which is a subset of this Sprint study that really helped change the guidelines back a year ago. So all of this is all interwoven and tied together. But the dementia piece is a very significant piece.
What about younger patients?
Yeah, so it applies across the board.
Okay,
so it applies younger and older. So there was benefit even if you were over 75 years old to improve cognitive impairment. But there was also benefit for young folks too, because then again, like we're saying, we're moving a battleship, and the earlier we can get on top of your blood pressure, the endpoint has changed dramatically.
You mentioned 140 and then 120, so those are the two, right, that they use. So 120, that's ideal, correct?
Correct.
140 is, now with the new guidelines especially, it's a little bit further over on the hypertension level.
We're moving that needle down to 130, 120 now. And so we want to get even more aggressive with it.
Okay, and as he mentioned, not too late. So even if someone who is 75, you can, if you have
this study supports that. That's right. Okay. That's right. Yeah. So go engage your primary care doctor. Go see a heart doctor. I mean, let's get that. Let's jump in the middle of that and be aggressive with it.
You mentioned getting a sleeve. You get them at the grocery store.
Yeah,
now, right?
You could go to Walgreens, Walmart. I mean, and they're $35. I mean, it's not going to break the bank, but and it's very. And by the way, get this kind, not this kind.
That's we've talked about that before. So why do you like
I'm an arm cuff
sleeve?
guy. I think it's more accurate.
Okay.
This you move your wrist around, and it can give you a variation on the number. This tends to be more consistent and even more accurate.
Okay, and if you can't afford one for any reason, a lot of places have one in store. You can just go sit down, get it taken as you're getting your weekly groceries or whatever it may be. So no excuses here, right?
Awareness is key, man.
That's right. Thank you so much, Dr. Davis. As always, you can contact Baptist Health anytime at the number on your screen. It's 1-888-BAPTIST, and you can also go to baptist-health.com.